Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And today we're going to talk about high blood pressure and exercise and how it benefits you, exactly how it benefits you, and something that can completely destroy the benefits of exercise on high blood pressure. Which is crazy to think that we're doing the right things, but it's not having an effect on blood pressure, and there may be a reason for that. So in this particular animal study, researchers looked at the benefits of exercise, but they looked at how much changes in the microbiome, the gut bacteria, played a role in the benefits. Now, this probably doesn't come as a big surprise because we've seen studies before that things like sunlight can have positive benefits on your gut microbiome, and we've seen studies where exercise has positive changes on the microbiome. So this took it a step further and the researchers looked to see what happened, and the results were pretty darn exciting. And they found that the exercise not only lowered systolic, so the top number blood pressure, it also lowered markers of inflammation, it lowered glial cell activation. And just in case you're not as excited about that as I am, it's because maybe you aren't aware of what glial cells are, but they are the immune cells in our brain. So basically the exercise through the gut bacteria led to less inflammation in the brain. Like, that's really exciting. That's something that is that exciting, or something that simple could have that strong of a benefit. Interestingly enough, there was also, one of the other things they saw was an increase in diversity in the gut. And if you've seen any of my videos talking about the microbiome, you will know that one of the most important things we know is having a good, diverse microbiome with lots of little characters growing down there. The example I usually have is if you lived in a village, would you want 6 people with the dentist also doing your colonoscopy? Or would you want to live in a large village with everybody doing what they're very good at? So a strong microbiome also includes a lot of diversity, and that was increased by exercise. Also, if you follow my videos, you know that antibiotics will destroy diversity, and it can take years to recover if it ever does. So there is a chance that if you're exercising and it's not having a positive effect on your blood pressure, could it be that you've been on antibiotics in the past 5 years and your gut still hasn't recovered? That makes a lot of sense, especially starting to look at studies like this. Interesting note, just in case you want to just sit on the couch and not actually exercise but get the same benefits, they did a fecal microbiota transfer, so an FMT. So they took the bacteria from the exercising rats and put the bacteria into the non-exercising rats, and they found the same benefits. So if you happen to have a really good friend who's an exercise nut, maybe you can have a conversation about sharing their fecal microbiome. Or you could just get off the couch and start exercising yourself. I would suggest that that's probably a little less distasteful, so to speak. As always, I will post a link to this study in the description. Make sure you share this video, like the video, and subscribe to the channel.